Order. Order. I call on Kemi Badenoch to make a statement.
With your permission, Mr. Deputy Speaker, I will make a statement. I came before this House on 4th of June, just after Public Health England had published its report, Covid-19 Review of Disparities in Risks and Outcomes, as the Prime Minister had asked me to lead the cross-government work to address the findings of the review. I return today to update the House on the progress I've made and to announce publication of my first quarterly report to the Prime Minister. My work to date has focused on the impact of Covid-19 on ethnic minority people. There is a wider strand of work within government that is considering other groups that may have been particularly impacted by COVID, for example, disabled people, and I will include updates on this wider work in future reports. My report summarises the significant measures that government departments and their agencies have to date put in place to mitigate the disproportionate impacts of COVID-19. And Mr. Deputy Speaker, I've spoken with the Speaker and many members of the House staff about how impressed I've been with the measures put in place by the parliamentary authorities to protect all of us who use the parliamentary estate. It's clear that there is a lot of good work underway. For example, as we've reported in Parliament, more than 95% of frontline NHS workers from an ethnic minority background had a risk assessment in the workplace to ensure good understanding of the necessary mitigating interventions in place. The NHS is working hard to restore services inclusively so that they are used by those in greatest need, with new monitoring of service use and outcomes amongst those from the most deprived neighbourhoods and from Black and Asian groups. We issued revised guidance to employers in July and again in September, highlighting the findings of the PHE review and explaining how to make workplaces COVID secure. We also reached out to all parts of the community through our information campaign. From March to July, we spent an additional £4 million on reaching ethnic minority people through tailored messaging, strategically chosen channels and trusted voices. We have published messaging in well over 600 publications, including those that have high proportions of ethnic minority readership. We have reached more than 5 million people through the Ethnic Minority Influencer Programme. We have translated key public health messages into numerous languages, which initiated a marked improvement in recognition of our crucial Stay Alert campaign. My report also summarises how the NHS, Public Health England and others are implementing the recommendations from the summary of the rapid literature review and stakeholder engagement work led by Professor Kevin Fenton. The PHE review indicated that people from ethnic minority backgrounds were disproportionately impacted by COVID-19. It told us what the disparities in risks and outcomes were, but not why they had arisen, and therefore it did not make any recommendations. It is therefore absolutely imperative that we understand the key drivers of the disparities and the relationships between the different risk factors in order to ensure that our response is as effective as possible. That response has involved collaboration across government, the Office for National Statistics, and with universities and researchers. It includes some of the 6 new research projects to improve our understanding of the links between COVID-19 and ethnicity, which received £4.3 million in government funding in July. These research projects will give us new information on a range of issues, including the impact of the virus on migrant and refugee groups and the prevalence of COVID-19 amongst ethnic minority health workers. These projects will also help to develop targeted digital health messages in partnership with ethnic minority communities. They will also provide a new framework to ensure the representation of ethnic minorities in clinical trials that are testing new treatments and vaccines for COVID-19. We now know much more about the impact of the virus than we did in June. We know more in particular about why people from ethnic minority backgrounds are more likely to be infected and die from COVID. The current evidence shows that it is a range of socio-economic and geographical factors, such as occupational exposure, population density, household composition, and pre-existing health conditions, which contributes to the higher infection and mortality rates for ethnic minority groups. However, according to the latest evidence, part of the excess risk remains unexplained for some groups, and further analysis of the potential risk factors is planned for the coming months. What has emerged is that interventions across the entire population are most likely to disproportionately benefit ethnic minorities and are least likely to attach damaging stigma. This is best captured through our experience of the national lockdown and the shielding programme. And as the CMO has said, we must assess the impact of COVID-19 based on all-cause mortality to incorporate its indirect impact. On this specific metric, early evidence suggests that there is no disproportionate impact across different ethnic groups. Indeed, the Open Safely study of 17 million adults from 1st of February to 3rd of August concluded, national data from England and Scotland has shown that most ethnic minority groups have both better overall health and lower rates of all-cause mortality than white groups. The evidence base is growing fast, and we will continue to work with academics and the SAGE ethnicity subgroup to improve our understanding of the relationship between COVID-19 and ethnicity. I'm particularly keen to deepen our understanding of how comorbidities interact with occupational exposure. This is a major gap identified by several studies to date and may well account for the residual risk between different ethnic groups of poorer outcomes from COVID-19. In general, we must move away from seeing COVID-19 as something that affects discrete groups in society and towards helping individuals understand their own particular risk profile as the evidence base grows. Looking forward, we know that a vaccine is likely to present a long-term protection against this deadly disease. The only way to check how well a coronavirus vaccine works is to carry out large-scale clinical trials involving a diverse group of thousands of people. That is why I am leading by example and participating in a trial myself at Guy's and St Thomas Hospital. And just last week, I wrote to all colleagues urging them to encourage more of their ethnic minority constituents to sign up to the NHS vaccine registry, as these groups are underrepresented in vaccine trials still. We have made good progress, but more needs to be done. In particular, we need to work with local communities to protect the most vulnerable. I am therefore announcing today a new community champion scheme that includes up to £25 million in funding to local authorities and the voluntary and community sector. This will help to improve the reach of official public health guidance and other messaging or communications about the virus into specific places and groups most at risk from COVID-19. Our community champions funding will support those groups at greater risk of this disease to ensure key public health advice is understood and safer behaviours are followed. This will help to rebuild trust, reduce transmission, and ultimately play a part in helping to lower death rates in the targeted areas and beyond. Councils have been working tirelessly to support and engage their communities through this crisis. They know how to do this best. The funding for a target group of councils will enable them to do more of what they know works, but also to go further by enhancing existing schemes. Learning from the Community Champion scheme will be shared with all councils and across all relevant government departments, enabling government and local authorities to hear directly from individuals and communities on the impact of the crisis. There are other measures we can take to protect those most at risk, and particularly those from minority groups. So in my report to the Prime Minister, I outline a number of recommendations and next steps. These include mandating the recording of ethnicity data as part of the death certification process, as this is the only way we will be able to establish a complete picture of the impact of the virus on ethnic minority groups. Appointing 2 expert advisors on COVID and ethnicity who will bring expertise from the fields of medicine, epidemiology and clinical research to the government's work going forward. Ensuring that new evidence uncovered during this review relating to the clinically extremely vulnerable is incorporated into health policy. Supporting the development and deployment of a risk model to understand individual risk from research commissioned by the CMO. I also want us to capture the good work being done by local authorities and directors of public health so that we can learn the lessons of what works at a local level. So there will be a rapid light touch review of local authority action to support ethnic minority communities. The package of measures I've announced today are the first steps in my year-long review. They will give us a better insight into how the virus is impacting ethnic minority groups, how we can best protect those who may be most at risk, and how we can address long-standing public health inequalities. I will report back to the House with a further update at the end of the next quarter.
Thank you. Video link. Marsha de Cordova.
Thank you, Mr. Deputy Speaker, and can I thank the Minister for advance sight of her statement. Coronavirus continues to expose deep-rooted structural inequalities in our society, and these drive the health inequalities. Today, the Minister has published her first quarterly report on progress into addressing COVID health inequalities, but it is now well over 4 months since both Public Health England reviews were published, and the country is sadly well into a second wave of this virus. Yet we are still lacking a forward-looking national strategy and action plan. Just this week, the IPPR and the Runnymede Trust showed that well over 2,000 Black and South Asian deaths could have been avoided during the first wave of this pandemic if those populations did not experience a higher risk of death from COVID-19, and that 58,000 people would have died in the first wave if the white population experienced the same risk of death from COVID as our Black populations. The government must be prepared to admit and act on the root causes of the hugely disproportionate impact that coronavirus has had on our Black and ethnic minority communities. And whilst I welcome the government's decision to make the recording of ethnicity as part of the death certificate process mandatory, collecting data is only one part of what needs to be done. The Minister mentions that there will be further research, but we don't know when this research will report and how quickly the government will act on its findings. And it is unclear how the government can measure or demonstrate the effectiveness of its public health communications for diverse communities and ensuring that such communications are actually inclusive and accessible. Given the scale and the urgency of this crisis that we face, the government has fallen short of what is needed. This first quarterly report does not commit to much that is quantifiable or timed, so I ask the Minister as a matter of urgency. She mentions that they will be looking into the clinically groups of people that are severely needing support. And I would ask her, when will that review take place? And when will those groups be added to the list of those that are shielding? And where's the government's plan of action to address the long-term structural inequalities, such as deep-rooted inequalities in housing, employment, including occupational discrimination? Where is the government's implementation plan with milestones for protecting our Black, Asian and ethnic minorities during this pandemic? Which local authorities will actually receive some of that 25 million funding for this Community Champions programme? And how did the government come about and reach this amount? And how will this funding be allocated to those local authorities, and what will be the criteria? Will the Minister now publish in full any or all of the equality impact assessments made of the likely impact of government's COVID-19 responses on our Black, Asian and minority ethnic communities? And can I say it's absolutely right that the NHS has carried out 95% of its occupational risk assessments. But why has the government only updated guidance for employers rather than putting in place proper checks and balances to make sure that our workers are being protected? And finally, why has it taken so long for the government to act on the disproportionate impact that COVID-19 is having on our ethnic minority communities? The volume of evidence that we have seen has been coming forward to us for months. We are already in a second wave, and this is now beyond urgent.
Thank you, Mr. Deputy Speaker. It doesn't appear to me that the Honourable Lady has actually read the statement which I sent to her. She is asking about what the government is doing. I've just given a statement about what the government has been doing over 4 months. I think we need to restate this. We didn't wait till today to say what we were going to do. As soon as we discovered we had that disproportionate impact, actions already went into place. She talks about us not issuing revised guidance to employers. We did that in July, and I said in my statement we did it again in September, highlighting the findings of the PHE review and explaining how to make workplaces COVID secure. We required passengers to wear a face covering in taxis and private vehicles, for private hire vehicles. We asked this to be done for hospitality staff, many of whom are from ethnic minority backgrounds. We provided £4.3 million in funding for 6 new projects. We provided a range of guidance to support those living in multi-generational households. We spent an additional £4 million on reaching ethnic minority people through tailored messaging, strategically chosen channels and trusted voices. She talks about the NHS guidance, the NHS risk assessments, as if that's the only thing that we have done. We've been implementing new payments for people on low-income areas with high rates of COVID-19 who need to self-isolate and can't work from home. What we are not going to do, and it's clear what the Honourable Lady and her party are expecting, are segregated policies for people from ethnic minority backgrounds. What we are doing is looking at risk groups, but tailoring support for the whole population. She talks about the IPPR report. My answer is that I don't recognise those figures. Their methodology was not transparent. Our statisticians in the Cabinet Office couldn't understand where they got the numbers from. I found the presentation scaremongering and alarming. It is really important to me, Mr. Deputy Deputy Speaker, that we let people have trust and faith in the government and let them know what we're doing. And that is why I'm standing here in Parliament giving this oral statement rather than just making a report to the Prime Minister. And she talks about what the government has done. I wrote a letter to every single member of Parliament asking them to share with ethnic minorities and their communities what they can do to join the National Vaccine Register. I've been taking vaccines myself. Members on the other side have not been doing so, especially she, knowing that she has a large ethnic minority population in her community. What has she done to tell them to join the National Vaccine Register? We haven't seen anything on her social media saying that. So why don't it would be quite good if they could show us that they're actually looking to help people, not just look for reasons to bash the government. We must not politicise COVID-19.
Video link. Caroline Oates.
Thank you, Mr. Deputy Speaker, and I too would like to thank my honourable friend the Minister for advance sight of her statement, which arrived whilst I was at a conference with Dr. Tony Sewell, the chair of the Commission on Race and Ethnic Disparities. His passion to make sure there is no stigma is only equalled by my honourable friend the Minister's passion. I welcome her commitment to mandatory recording of ethnicity data on death certificates, but could I ask her to give us a little more information about the commitment of new evidence relating to the clinically extremely vulnerable? Exactly how is that going to be incorporated into health policy, and by when?
I thank the Honourable Lady for that question. It is something that should happen right now. What we want to make sure is that things aren't happening in government separately. I've been very, very keen to ensure that there is no silo working. And one of the problems that I think we often have is that different departments are doing different things and often duplicating information and duplicating work. So we have been at great pains to make sure that that does not happen. So every single thing that I am doing, I'm making sure that I'm sharing with ministers across departments. We have a group of ministers who look at equalities in DWP, in health, in education, making sure that every single thing that we learn, we're feeding to them. And as they make policy, whether it's health or otherwise, that the findings that we're coming from the Race Disparity Unit and across the ONS and research are being fed in. We don't want this to be a separate government project that requires new oversight. We all have to work together, and that's how I plan to do it.
McLaughlin.
Thank you, Mr. Deputy Speaker. And I thank the Minister for her statement today. I'm interested in some of the things, or in all of the things that are in it, and I would commend her for volunteering to be part of that vaccine programme. I want to just raise two, possibly three issues if I've got time. Minority ethnic women, particularly overrepresented in frontline care roles, and so they're at particular risk of job disruption, as highlighted by Close the Gaps report. And I just want to ask why the UK Government has not matched the Scottish Government's action of a 3.3% wage increase for all adult social care workers, ensuring that at least the real living wage is paid across frontline care, covering all hours worked, including sleepovers. She said that help across the population disproportionately benefits Black, Asian and minority ethnic people, but one group that it does not apply to is those that are in have no recourse to public funds. And I know she's spoken about this before, but most people that have no recourse to public funds are from Black, Asian, minority ethnic communities. So will she support our calls for those people to be able to get support? And finally, I just want to note that she said she'll include updates on other groups disproportionately impacted in future reports. And I want to be sure that one of those groups being considered is older people. We know that people living in poverty are disproportionately impacted, and one way to lift older people out of poverty is to make sure they know about pension credit, to make it as easy as possible to apply for it. The more voices across this House and across the departments committing to ensuring older people know about the £2 billion plus that is unclaimed every year on these islands, the better. So I hope she will commit to paying particular attention to that particular issue.
I thank the Honourable Lady for her questions. She's absolutely right to raise the issue of older people who are the most disproportionately impacted group. If you are over 70, 80, you're 80 times more likely to have this disease as opposed to being from an ethnic minority background, where it's between 1.2 and 1.8 times more likely. So we do have to keep this in perspective. But the point I'm making is that we're looking at everybody who is impacted, whatever way that they're being impacted, whatever way they are being vulnerable. She asked asks about money that we are spending on adult health and social care. We are spending an unprecedented amount in this pandemic. We have targeted as much money as we possibly can to all the groups that we believe need it. It may not necessarily be exactly the thing that people have asked for, but what we are doing is looking at decisions in the round to make sure that we're covering all groups. Thank you.
Video link. David Davis.
Thank you, Mr. Deputy Speaker. I congratulate the Minister on a comprehensive report. She's clearly done a great job of identifying the numerous factors that exacerbate this problem and acting rapidly on them. However, of the first 26 doctors to die from COVID-19 in the National Health Service, 25 of them were from minority ethnic backgrounds. These doctors will have been comparatively well paid, so poverty cannot be the full explanation there. Vitamin D deficiency is prevalent across virtually all the groups that suffer disproportionately from COVID-19, from the elderly to the obese to diabetics, and including ethnic minority communities. Today's review only considers 2 studies on this and doesn't consider the huge range of new evidence that's come out in the last month or 2, showing powerful links in this area. Will she now do what her colleagues at the Department for Health are committed to do and look again at the latest evidence on this matter?
I thank the Honourable Gentleman for his question. We did look across a range of issues as to why that might have been the case. It was the number of ethnic minority doctors who had died right at the beginning of the pandemic that alerted us to this issue. So I would remind him about the point about occupational exposure. Occupational exposure, we believe, is the biggest cause, and they were the most exposed, probably doing the shifts right before we knew what was going on, catching the virus much earlier. We also looked at things like vitamin D, for example. SAGE, the 23rd of September report, they looked at studies on vitamin D to see if that had had an effect. They didn't find any relationship. So we have found that there is a small residual risk. And I'm looking at the interaction between comorbidities and occupational exposure, we think would explain this. We had a second literature review and stakeholder engagement report where many people talked about their experiences of systemic racism. And this was something specifically I asked RDU to look at. But the findings we've come out with do not support that. So, for example, when we take into account comorbidities, Bangladeshi women and white women have exactly the same rate of infection and death. That's what our findings had. Mortality rates, not infection rates. So systemic racism doesn't explain that. It also doesn't explain the differences between various groups like Black Africans and Black Caribbeans. If it was systemic racism, that's what we would expect. We would expect those things to match, and they don't. So there's still quite a lot going on, and that's why we're looking at those things, the socioeconomic, geographical factors, occupational exposure, population density, household composition, pre-existing health conditions. And we will continue to do this work. Remember, this is the first report, not the last one, and this review will be ongoing. Thank you.
Amajit Singh, Desi.
Thank you very much. Mr. Deputy Speaker, having volunteered in recent months to become a community champion locally, I welcome the additional funding announced today by the Minister, and I sincerely hope that our excellent scheme in Slough will be able to gain some of that funding. The report mentions a SAGE subgroup on ethnicity. What are its terms of reference, membership and programme of work?
Thank you. So the SAGE subgroup is looking at this issue. Not all of the research that we have been carrying out is original research. Much of what we've been finding out has come out of that SAGE subgroup. And we have Emran Mian, who has been leading from within that subgroup, who is working with us. I'm afraid I don't have the terms of reference for the subgroup, but I can write to him on that and provide him with more information. But what I can tell him is that we're very supportive of all community champions' work, and the work he's doing in Slough, we believe, is very important. And if it is possible, we will make sure that he can access the Community Champions Fund. He will need to apply through the regular process, but we want to do as much as we can to support MPs all across the House.
Elliot Colburn.
And I would certainly like to join my honourable friend in encouraging Carshall and Wallington residents to follow her lead to volunteer for vaccine trials. Can I welcome the Minister's statement today, and including the appointment of independent experts and the mandatory reporting of ethnicity on death certificates. Would you agree with me that this gives us the opportunity to learn a lot more about the impact of COVID on Black, Asian and minority ethnic constituents of ours? And could you say a little bit more about how we intend to use this data to improve health outcomes for everyone in the country?
I thank my honourable friend for that question. So the reason why I have asked that we mandate the recording is because that was one of the gaps identified. We didn't get a full picture of what was going on, and we need to have a full picture. And as he rightly says, everything we're doing is going to help the whole population. We are not segregating this disease. We're not segregating people on the basis of this disease. And mandating ethnicity data is not just going to help ethnic minority populations, it's going to help everybody.
Video link. Tony Lloyd.
Thank you, Mr. Deputy Speaker. Can I, I'm sure the Minister will be well aware of the research by the Financial Conduct Authority that whilst 1 in 3 of our fellow citizens have seen an income cut because of COVID, that rises to 40% amongst Black, Asian and minority ethnic communities. And of course, the impact is not simply individual or even on households. Where there's a concentration of people from varying backgrounds, it affects the much wider community. What research is the Minister going to engage in the economic impact? Because we do know, of course, that economic collapse does lead as well to lower mental and physical health and all the other social ills that come with it.
And that would be outside the terms of reference for this review that I'm leading over the year. But as a Treasury Minister, I can tell him that we have distributional analysis that comes out with all of this information and does influence all the policies that we put out in terms of economic interventions for specific groups.
Philip Hollowburn.
I commend my honourable friend for her statement and for the report. Given the high level of concern about the impact of COVID-19 on ethnic minorities, and given that a vaccine is going to be a very large part of the solution to the pandemic, why does she think there's been such a disproportionately low number of ethnic minority people coming forward to volunteer for the NHS vaccine registry?
It's an excellent question, and I must say that I have been particularly disappointed at the amount of anti-vaxxer disinformation campaigns that are out there. I have received 3 separate messages myself from people telling ethnic minorities not to take part in vaccines. And I'm really sorry to say that in this House, a member on the opposite side of the House said that the government was using ethnic minorities as cannon fodder in its battle against coronavirus. One of the worst things that I've ever heard said in this House that really causes division and tension. We need people to have faith in the government. We need people to have faith in our health service and trust it in order to take part in things like vaccine trials. And I hope that the work we're doing will go some way to remedy some of the scaremongering.
Munira Wilson.
Thank you, Mr. Deputy Speaker. I welcome the Minister's acknowledgement early on in her statement about the disproportionate impact of COVID on disabled people. And I note that she says there's work ongoing and there'll be future reports, but I hope she'll agree with me that we do need urgent action. She will know that disabled people are 11 times more likely to die from coronavirus. And we've also heard very disturbing reports of do not resuscitate orders being put in place, particularly for those with learning disabilities, without consultation with their families. I recognise the CQC are investigating this, but will she commit to ending this injustice urgently?
I thank the Honourable Lady for her question. The Government rightly takes very seriously the outcomes for those with disabilities. The largest disparities were by age for both males and females, then by gender, but there is a wider strand of work which she references, and I think that is something that they will be looking into. We cannot allow any part of the population to feel that they have been forgotten, and they have not. And I can assure her that this is something that we're taking seriously, not just in the Equality Hub, but also in DWP.
Video link. Bob Blackman.
Thank you, Mr. Deputy Speaker. My honourable friend will know that my constituency is home to a wide variety of different people from different nationalities and ethnic backgrounds, particularly from the Indian subcontinent. Very sadly, we have seen many deaths, particularly amongst the people from the Indian subcontinent. One of the reasons that he's suggested for that is one of the virtues of that community, namely that they often have grandparents, parents and children living in the same household, where the grandparents look after the children when they come home from school, and the parents go to work and commute, particularly into central London. In those instances, there seems to have been many people who've been infected with the disease and very sadly died. Can my honourable friend then therefore look at this particular issue to see if it is that mixing of people that is causing so many problems amongst our ethnic minority friends.
The honourable gentleman, my honourable friend, is right. Household composition is definitely one of the things that we looked at, and it was identified as a factor, and we're looking further into the significance of this. So in the interim, the government has provided a range of guidance to support those living in multi-generational housing, alongside detailed advice to employers and key workers on how they can protect themselves. So we'll continue to ensure that our guidance is clear and enables people to protect themselves adequately, and includes guidance for those shielding. And supporting this, we've given councils an additional £1.6 billion of the COVID budget fund to help them protect and support people during this national emergency. But there is, as I always say, the government will do everything it can, but it can't do everything, and it's why we need people to know how they can protect themselves.
Lillian, Greenwood.
Mr Deputy Speaker, since the start of the COVID pandemic, the all-party Parliamentary Group on Deafness has repeatedly called on ministers to ensure that all communications are accessible and inclusive. But on Monday, we saw reports that deaf children are being deprived of their access to education. I note that she's promised future updates, but is the Race Disparity Unit working across government to ensure all communications are accessible to deaf and blind people? And what's she doing to ensure that Black, Asian and ethnic minority disabled people are not doubly disadvantaged by measures needed to control the virus?
So she's absolutely right. This is something that we have looked at. So, for instance, the government has looked at sourcing PPE for those people who, for instance, need to lip read so that they're able to continue communicating. And she's also absolutely right to point out that some people are affected in multiple ways. But looking at each of those issues separately doesn't mean that one aspect of it is going to be forgotten. They will be helped by all the separate work that is being done across the board to make sure looking at vulnerability.
Video link. Crispin Blunt.
Can I thank my honourable friend for her comprehensive statement? And I might note that she seems to have been on a bit of a roll in the chamber this week. But will she recognise that there remains a paucity of data around health outcomes for LGBT people, perhaps not least in respect of the intersectionality with BAME people in respect of COVID? This data deficit was identified in the LGBT Action Plan, and will she recommit the government to securing this data, not least by ensuring that future public health surveys record data on all protected characteristics?
I thank my honourable friend for that question. He is right that we are looking across the board, but I just wanted to remind him that we're looking at those who have been most disproportionately impacted and those who are most vulnerable. While we have not found that LGBT groups specifically have been disproportionately impacted, where we know that they are losing out is where healthcare services have been unavailable because they're having to close or to provide other services to deal with the pandemic. And that is something that we are looking to improve as we go forward. But the review that I am carrying out is specifically looking at the vulnerability and disproportionate impact.
Video link. Howell Williams.
Thank you, Mr. Deputy Speaker. I'm glad that information is available in different languages. Real language choice provides a clear functional gain, as we know in Wales. However, I'm against shifting away from seeing the pandemic as affecting discrete groups. Will the Minister commit the government to continue and extend economic supports as further evidence reveals groups who have been hardest hit?
I thank the honourable gentleman for his question. He is right to raise the issue of making sure that people have access to all the information that is available. Much of the work that we have been doing has been with PHE, which mainly looks at England. But I will find out what information I can provide to him about the work that's being done in Wales. But the government is looking to make sure that everybody has access to the information that they do have. And we are working with devolved nations as well to make sure that they have examples of best practice that's happening across the board.
Please, Green.
Thank you, Mr. Speaker. I thank my honourable friend for her statement and the fact that it highlights a whole range of factors which are distributed right across the country. We know and understand the cost of COVID to a certain extent, but also there is a cost of the lockdown. We have national figures, for example, in reduced GP appointments, cancer screening and hip operations. Would my honourable friend commit to working with ministerial colleagues to produce a constituency-by-constituency COVID lockdown health impact assessment? Because to represent our constituents, we have to have that local data.
That's an interesting suggestion from my honourable friend. I do believe information like that exists, so I'm very happy to meet him to discuss further and get exactly what it is that he would be looking for and see if we can do something to produce information like that.
Video link. Stephen Bonner.
Thank you, Mr Deputy Speaker. With data showing us that only 1 in 10 lower earners can work from home, and also that 69% of low earners are women, women have clearly started this crisis from a position of economic disadvantage. They have, in many areas, led the fight against coronavirus, but we know millions of women are stuck in low-paid and insecure jobs. So can I ask why then, according to Businesses for Communities, this government chose to exempt companies from having to file any gender pay gap data this year, resulting in only half of businesses actually doing so?
Thank you, Mr Deputy Speaker. The reason why we suspended gender pay gap reporting was right at in the middle of the pandemic, and we wanted to reduce burdens on businesses that were facing an unprecedented situation, and we were not going to put any additional burdens on them. Companies which are able to can continue to report the carry out their gender pay gap reporting, but I would remind him that this review has been about those who are most disproportionately impacted medically, and at the moment that is actually men, not women.
Video link. Henry Smith.
Thank you, Mr Deputy Speaker, and I very much commend my honourable friend on her statement today. White working class boys are amongst the lowest in educational attainment, and that has only been exacerbated by the effects of COVID-19 and them not being able to be in school. What discussions has she had with our right honourable friend, the Education Secretary, to ensure that any child from every background can achieve and won't be left behind for the future of our country's well-being?
Thank you, Mr Deputy Speaker. My honourable friend is right to allude to the importance of being in school to children and young people. And the government has been very, very clear that limiting attendance at school should be a last resort, even in areas where a local alert is high or very high. We've been providing laptops to the most disadvantaged pupils and 4G routers for families who do not already have mobile or broadband, for example. And in the unlikely event that certain schools need to reduce attendance, we're also helping them to deliver quality remote education. But more broadly, on ethnic disparities in attainment, the Commission for Race and Ethnic Disparities announced by the PM in June will look at outcomes for the whole population, and it's specifically looking at education.
Stephen Doughty.
Mr Deputy Speaker, I hope the Minister has also been liaising with my constituency colleague, the Minister for Health in Wales, Vaughan Gething, on the work that he's been doing on these issues. One of the first to identify them, set up a task force and put in place measures to address what he said in his recent statement was a very clear adverse and disproportionate impact on people from BAME communities. But I wondered if she could tell me the evidence from the UK Intensive Care National Audit and Research Centre has consistently shown throughout the crisis a higher frequency of patients from BAME backgrounds requiring critical care than expected from the population. The latest figures showing it's over 30% just in the last few weeks, and very disproportionate impacts compared to the wider population. Why does she think that is, and is she incorporating that important research into the evidence that government is looking at?
It goes back to the factors that we have been looking at: occupational exposure, comorbidities, and we haven't finished the research that we're looking at. There's so many research projects out there that are trying to find out exactly what is causing perhaps severeness in criticality of infection, for example. I think that this is something that the RDU has looked at. We've taken information from across the board, across lots of universities, researchers, and the ONS, and I believe that this has been fed in. And if it hasn't, it's something that we can look to do in the next quarter.
Katina.
Mr Deputy Speaker, one of the medical risks that's facing our BME communities is not just the risk from COVID, but the fallout from other health conditions as well. Would the honourable member agree with me that we should encourage the BME community to access those health treatments which are available to them, such as cancer treatments, as this is important to their health condition as well?
She is absolutely right, Mr. Deputy Speaker, and we also must reduce fear and build confidence amongst ethnic minority people in engaging with NHS services. So phase 3 of the NHS COVID-19 response is taking urgent action to reduce health inequalities and regularly assess progress. NHS trusts are encouraged to restore services inclusively so they're used by those in greatest need, and we're separating COVID wards and spaces, and we should give people confidence to return and to allow more routine procedures to continue.
Video link. Stella Cruz.
Thank you, Mr. Deputy Speaker. The Minister mentions further research. One area where there is very specific and clear research is around pregnancy. The UK obstetric surveillance system back in May showed that black pregnant women were 8 times more likely to be hospitalised than white pregnant women due to COVID. And indeed, half of all pregnant women in hospital due to COVID are from black and ethnic minority backgrounds. That research came out in May and June this year. Could the Minister update us on specifically what is being done to protect black pregnant women from the risks of COVID and whether there will be an investigation into that specific issue?
I thank the Honourable Lady for that question. I co-hosted a roundtable on maternal mortality, on maternal mortality rates for ethnic minority women with Minister Dorries in September, on the 2nd of September, to develop appropriate solutions to benefit pregnant women and their babies during this period. And given that COVID-19 has fundamentally changed the way women access maternal services during this time, NHS e-Safety Champion and Chief Midwifery Officer for England published a 4-point plan for all maternity services in England to follow. And this includes increasing support for at-risk pregnant women, reaching out and reassuring pregnant ethnic minority women with tailored communications, ensuring hospitals discuss vitamin supplements and nutrition in pregnancy with all women, and ensuring all providers record on maternity information systems the ethnicity of every woman as well as other risk factors. This has been a topic of particular interest to me, Mr. Deputy Speaker, because as you know, I returned from maternity leave after my 3rd child just this year, and it's a topic very close to my heart, and I'm doing quite a lot of work on it and will continue to do so.
Steve Baker.
I welcome the appointment of independent experts on COVID-19 and ethnicity, like Wickham resident Dr. Raghib Ali. What main risk factors has she identified working with them to explain why it is that BAME communities are so disproportionately affected, and will she take steps to make those risks more apparent to the individuals affected?
Thank you, Mr. Deputy Speaker. On the appointments of the advisors, I do agree. I'm absolutely delighted to announce the appointment of Dr. Ali and also Professor Neil. They are specialist epidemiologists and health technology advisors who are experts on COVID-19 and ethnicity, and I'm appointing them to provide medical expertise as critical friends, not just people to agree with everything that we say over the coming months. But on factors, analysis from ONS, PHE and academia revealed that differences in COVID-19 mortality between ethnic groups were strongly associated with geographical and socioeconomic factors. ONS found that the risk of death from COVID substantially reduced when factors other than age were accounted for, but there was still a higher risk for Black and Indian adults and Pakistani and Bangladeshi males. Similarly, an Oxford University study found that ethnic differences persisted even after accounting for key explanatory factors such as the ones that I've mentioned before, and that's part of the work that we're still looking at.
Video link. Afzal Khan.
Thank you, Mr. Deputy Speaker. Data shows that nearly a third of COVID patients admitted to intensive care since September are from Black, Asian, and minority ethnic backgrounds, meaning that once again, we are bearing the brunt of the second wave of coronavirus. It appears no lessons were learned or effective actions taken over the summer. Chair of the British Medical Association, Dr. Nagapal, has deemed the situation Groundhog Day. Does the Minister recognise this failure?
No, I don't recognise that statement. In fact, I've had meetings with Dr. Nagpal, and we have had many discussions on further recommendations, which he's given directly to me, which we have taken forward.
Video link. Peter Bone.
Thank you, Mr. Deputy Speaker, and I would like to thank the excellent Minister for coming to the House and making a statement. I think the Minister said that people over 70 were 80 times more likely to be affected by COVID. If that is the case, what measures are the government putting in to protect people who are 70 or older?
I thank the honourable gentleman for that question. I think I might have, if I might have misspoken, it might have been people over 80 or 70 times more likely. I need to make sure that I'm getting the statistics right. I will confirm for Hansard. But this is something that the government is taking extremely seriously. We've made sure that people have the guidance on what to do depending on their individual risk profile. People who are elderly, especially clinically extremely vulnerable, as he would have known, were shielded, and we're making sure that information is being provided to local authorities, to NHS trusts, to GP surgeries, and other support within the community to make sure that they continue to do so. And this might be something that the community champions can again reinforce.
That may have been a passing motorbike, I don't know. Video link, Claire Hanna.
Thank you very much, Mr Deputy Speaker. Minister, it's very clear that alongside BAME communities, women have been disproportionately impacted by the pandemic. They make up the large majority of workers in those sectors that are unable to operate, and obviously in very many cases are carrying much larger roles in caring, both informally and formally. Northern Ireland already had the lowest levels of employment for women, and that's in the context of the UK slipping down gender inequality rankings even before the pandemic. Can I ask the Minister, will she be advocating for specific targeted economic support for women to address those structural inequalities that are being very much exacerbated by COVID-19?
The approach that the Equality Department is taking is that support has to be given in the round. We are not isolated as individuals, and we're certainly not segregating. So on the issue of gender, for example, medically, and the work we've been looking at in this report, it's men who are disproportionately impacted. Economically, depending on the sector that they work in, it's women who are disproportionately impacted. We need to look at helping everybody. What we're not able to do is provide, and in fact it might be contravening the Equality Act, is say that we're going to give specific help to women but not to men or to specific groups based on protected characteristics. We need to provide support to those based, to people based on need, and that's what we will continue to do.
Catherine Fletcher.
Mr Deputy Speaker, may I congratulate my right honourable friend on the Community Champions scheme and the new funding today. You know, our excellent local Lancashire LRF have been advocating for this, and there's no substitute for on-the-ground intelligence. Will she ensure that these champions are prioritised for Tier 3 areas like Lancashire to make sure that we can make the most of getting the transmission rates down?
Mr Deputy Speaker, I thank the my honourable friend for her question. Evidence shows that government COVID-19 guidance is not reaching certain communities or audiences who are being disproportionately impacted. So that's why we're providing up to 25 million to local authorities and voluntary and community sectors to improve the reach of official public health guidance and other messaging into specific places and groups most at risk, and that does include Tier 3. We want to ensure that the funding is used to support communities and groups who are being shown to having suffered a disproportionate impact.
Video link. Kenny McCaskill.
Thank you, Mr Deputy Speaker. The Minister acknowledged that disadvantage through ethnicity can be compounded further by disadvantage through disability. In these circumstances, will she press her government colleagues to recognise the vital need to address poverty that compounds it still and argue for the retention of the universal credit uplift and indeed its extension to legacy benefits, including those for the disabled?
I thank the honourable gentleman for his question. I know that this is something that the Secretary of State for Work and Pensions and my right honourable friend, the Chancellor, have spoken about specifically over many sessions in this chamber. What I would say to him is that poverty, deprivation, and various factors are contributing to health inequalities. This is something that we do know. And that work is not going to be solved, those issues are not going to be solved by a year-long review. They are things that we need to look at across government, like he says. And this is something that this government is absolutely committed to. We've talked about levelling up over and over again. It is absolutely the ambition of this government, and we will do that in the ways that we believe are best.
Gaga Mahendra.
Thank you, Mr Deputy Speaker. Can I firstly welcome the update from my honourable friend and applaud her on the excellent work she is leading in this arena. Can she tell the House what steps she is taking to improve public health communication, especially to those communities that are normally harder to reach?
We have worked with the COVID Comms Hub in the Cabinet Office and ministerial colleagues to build on the way that public health messages are effectively delivered to ethnic minority people. In addition to the central marketing campaign, we spent approximately £4 million to reach ethnic minority people through tailored messaging and strategically chosen channels and trusted voices. Additional funding and resources from the central campaign are also used to reach communities in specific regions, supporting local authorities to deliver bespoke translated material on request.
Video link. James Murray. Hold on, James. We can't hear you.
Can you hear me now, Mr.
Yes,
Deputy Speaker?
we can. There we are. Well done.
Thank you, Mr. Deputy Speaker. On May the 3rd, Ranjith Chandrapala, a bus driver from Hanwell in my constituency, became one of the many BAME frontline workers to have died of COVID-19. Since then, I've asked the Chancellor and the Transport Secretary to extend the government's COVID-19 life assurance scheme for families of health and care workers to others, including the families of bus drivers like Ranjith's. Unfortunately, I've only received promises that support for key workers will continue to be reviewed. And so, as the Minister mentioned that today's report highlights a significant occupational exposure, will she commit to meeting with me and Ranjith's family to discuss how we can ensure this scheme is extended?
I thank the honourable gentleman for his question, and I share with him deep sympathy for the suffering of his constituents. It's something that all of us are seeing across the House. I've had cases like that in my constituency, and they are really devastating and heartbreaking. I know that many members across the House have lots of suggestions for specific interventions that we can make. And, I stand here not just as an Equalities Minister and as a Treasury Minister. We've said we were going to do whatever it takes, but we can't do everything that everyone likes. And if he will write to me on the issue, it's not something that I've been cited on. Perhaps I can provide him with further information.
Video link. Selene Saxby.
Thank you, Mr. Deputy Speaker. In our continued battle against COVID-19, we have become much more knowledgeable about this terrible disease. However, what remains unclear is why some people are more at risk than others, including my more elderly residents of North Devon. Does my right honourable friend agree with me that if we are to tackle this virus effectively, it is essential that we understand the key drivers of its disproportionate impact?
I thank the Honourable Lady for that question, and it's something that I really like re-emphasising, that we shouldn't jump to conclusions. We need to know why, because if we misdiagnose, then we're not able to solve the problem. We need to find out the exact reasons why things are occurring so that we can have the right solutions.
Lynn Brown.
I utterly agree with that. Thank you, Mr. Deputy Speaker. Can I thank the Minister for his statement and promise to read it carefully after today in order to work out what I can personally do in my constituency to aid this work. In June, I urged the government to act upon the unequal risks before the second wave, and I pointed out that Black and Asian people were not properly represented in the clinical trials. The second wave's here, and Black and Asian people the data has shown that the same inequalities are occurring. So can I ask the Minister to assure me and my constituents that from now on research projects and clinical trials will have the appropriate numbers of Black and minority communities reflecting their higher risk?
I do agree with her. She and I are not going to have disagreement on this issue. We need to get as many people from all communities represented, but we can't force people. We need to encourage them, and we need to get them to see the benefits of that. And that's why I urge everyone across the House to do that. If we scare people, or if we allow those people who are sending misinformation about vaccines to continue with their messaging, then we won't see that. So I do agree with her, and I thank her for raising the question.
Virginia Crosby.
Mr. Deputy Speaker, can I thank the Minister for her statement and congratulate her on further support for community champions who are vital at this exceptional time. Can the Minister share further details as to why the measures are not targeted specifically at ethnic minorities and what this means for my constituents in Wales?
I know the Honourable Lady is a real champion for communities in Ismond, particularly with her Hidden Hero campaign. And I thank her for her hard work on that and for her constituency. The current evidence is showing that it's a range of factors which I've mentioned already, occupational exposure, comorbidities in particular, and these are factors that affect the whole population regardless of race, and we need to protect the whole population. But I am also very keen that we do not stigmatise ethnic minorities or make it seem like they are carriers of the disease. Targeting specific things and saying this is just for black people, this is just for Asian people, will actually create division, it will stigmatise, and it won't necessarily go to the people who need it most. And that's the message that I would say to her colleagues in Wales, that this is what we have found, and we hope that they agree with us and will accept this as the way to go. It's targeting the whole population, knowing what the vulnerabilities are, and not stigmatising groups.
Neil Hanvey.
Thank you, Mr. Deputy Speaker. I spent most of my professional career in London working with friends and colleagues from the BAME communities. So it was quite upsetting for me to find that over 70% of all NHS and care deaths were as a result of the first wave of COVID were from black and minority ethnic communities. Whilst the reasons for these deaths are not fully understood, there is some anecdotal evidence that the deployment of staff from BME communities to either high risk or low protection areas may have played a role in that feature. And I would like the Minister to advise me what action has been taken in collaboration with the Health and Social Care Department into potential structural issues in the care services to prevent any repeat of this in the second wave.
He's absolutely right to raise this. This was the very issue. If you remember, when I mentioned the 95% of ethnic minority workers who had risk assessments, which we talked about at several points at orals in this House, that's the issue that they have been trying to tackle. It's absolutely important that risk factors are taken into account before people are deployed into various sectors. We know that ethnic minorities are overrepresented in lower paid parts of the NHS. That's, again, a structural issue that we will be tackling. But the risk assessments are the key thing, to make sure people understand their risk, and that's how we'll deal with that.
Dr. Luke Evans.
Thank you, Chair, and I welcome the Minister's statement today. And in the Health Select Committee, we're starting to look at this area as well. But is she aware of the paper in The Lancet titled "The Impact of Ethnicity on Clinical Outcomes in COVID-19, a Systematic Review," published in June, that broadly picked up three areas: biological, ideally, the ACE2 receptors, difference in immune responses, the medical aspect, people having different cardiovascular risks and diabetic risks, and the social economic factors around crowding and job type. The study noticed limitations with all this area and which predominates. So will she commit to a roadmap to get more evidence and research to better understand the factors we can control and the ones we can't?
I will ask my colleagues at the Race Disparity Unit to have a look and see if we can have a roadmap. Thank you.
Hayes.
Thank you, Mr. Deputy Speaker. Many cleaners, facilities management staff and security staff working in government buildings are from black and minority ethnic backgrounds. What action is the Minister taking to address the terrible disparity in employment terms and conditions for these staff, which leaves them without the protection of full sick pay in the event that they have symptoms or need to self-isolate, putting both those staff and others working in the same buildings at greater risk?
The government is providing money to those people who do have to self-isolate. On the broader issue of people from ethnic minority backgrounds working in lower paid employment, this is one of the things that we've dealt with as part of the employer risk guidance, which we have repeatedly given in July and in September.
Lucy Allen.
Mr. Deputy Speaker, can I say what a fantastic job the Minister is doing in tackling some of the most difficult issues head-on. I pay tribute to her for her courage, and I would like to thank her for participating in the trial at Guy's and St Thomas's. And it is abhorrent that any member of this House should do anything to discourage participation in any such trial. And does she agree with me that it is the duty of every member of this House to work with our communities as leaders in encouraging participation in such an important trial?
I do agree with her, and as I said to the Honourable Lady, this is not something that should be a cause for division in this House. We should be working together on it. I didn't write the letter just to Conservative colleagues, I wrote it to all colleagues, and I hope that people will take up the notes that was in there and are able to share across their communities.
Maz Shah.
Thank you, Mr. Speaker. I'm glad the Minister referred to her letter, because I've just had a huge check, and I certainly haven't received a letter from her as she's referred to our Shadow Deputy Secretary of State. Mr. Speaker, on the 19th of April, I wrote to the Secretary of State for Health and asked about languages specifically, offering my help and support in reaching ethnic minorities. I have a large minority. I come from Bradford, a diverse city, and Bradford West is one of the most diverse constituencies in the country. Again, I asked about languages commissioned in September in a written question, and as have others. And whilst I appreciate today the Minister has said we've spent £4 million, the truth is, whilst this debate has been going on, I've spoken to commissioners for Geo News, Dunya News, ARY, Channel 44, and £4,000 has been commissioned for the 12 channels that I know who communicate in the language of Urdu, and that's without speaking to all the Bain media, just whilst this question was going on. Sunrise Radio, the largest Asian radio outside of London, has had one campaign from the 2nd to the 7th of May in Hindi, Punjabi and Urdu, and now a campaign, nothing, Mr. Speaker, from the 7th of May right until the 19th of October. So how can she stand here and tell this House that they have been reaching out, BAME communities, and Jang newspaper had to go to Downing Street and negotiate for written, not for radio communication and not for TV adverts. So when will the party opposite get real about communicating honestly with black and minority ethnic communities in their languages?
We have published public health messages in over 600 publications. If she would like to write to me with places that haven't received communications, that's something I can take up with the Cabinet Office. But I myself have done quite a bit of media, BBC Asian Network and BBC Radio Manchester and other local areas, local media outlets. I have done lots of social media activity. We've had ethnicity, ethnic minority influencers reaching 5 million people. I'm sorry to say, if the Honourable Lady is not seeing these things, then perhaps she's not watching. But the money that we've spent is a testament to how hard we're working to reach people. There are still some hard-to-reach communities. That is why we're having the community champions, because at the end of the day, it can't just be TV, it can't just be social media. We need local authorities and people who know their local areas to be able to go out and find those people who still aren't hearing the message. And I hope that that's something that she will do. And I will find out from the House why she has not received the letter. It should have been sent to all colleagues, and I know many across the House have received it.
Tom Hunt.
Thank you, Mr. Deputy Speaker. I recently had the honour of becoming the ambassador for BSc Multicultural Services in Ipswich, which, as well as supporting our large and thriving Bangladeshi community, also supports people from over 50 other nationalities. Throughout the Covid-19 pandemic, they provided invaluable work getting food parcels to the most needy from those communities. But right now, their finances are under strain ever so slightly. I was wondering if the Minister could give both I and also the other leaders of the group some reassurance about potential financial assistance to them going forward.
I commend my honourable friend for the important work he's doing to support his community. The government agrees that charities play an invaluable role in this country, which is why we've committed a £750 million package of support specifically for charities, social enterprises and voluntary sectors so that they continue their work through the outbreak. And that includes £200 million, which is being distributed by the National Lottery Community Fund through the Coronavirus Community Support Fund. The fund closed to new applications on 17th of August, but about 97% of it, the total fund value, has been awarded as of 13th of October 2020. And in addition, £150 million has been released from dormant accounts to help social enterprises get affordable credit to people who are financially vulnerable and support charities tackling youth unemployment.
Video link. Debbie Abrahams.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, COVID is a disease of poverty. The evidence clearly shows that there's a higher prevalence of and mortality from the disease in areas of high deprivation. In addition to people from Black, Asian and minority ethnic groups being at risk of COVID, disabled people account for nearly 60% of all deaths between March and July. They're more likely to live in poverty than non-disabled people, and also accounted for a third of the 300,000 people who weren't eligible for social security support in the spring. I understand that the Equality and Human Rights Commission are examining discrimination of disabled people during COVID, but what is the government doing to protect disabled people's lives and livelihoods in the second wave?
As I said earlier, Mr. Deputy Speaker, the government really takes it seriously, the outcomes for those with disabilities. There is a lot of work across government that is happening across very many departments. We are not leaving anyone behind. We're making sure that support is available, not just at national level through support schemes, but also through local authorities and through job security, through the Department of Work and Pensions locally. And if she wants more information on it, I'm sure it's something that I can write to her about. I don't have the full information to hand, but I do know that there's a lot of work going on across government.
Come to the last two questions now. Dr. Ben Spencer.
Thank you, Mr. Deputy Speaker, and I thank my honourable friend and welcome this incredibly important and ongoing work. Does she agree with me of the importance of using science to determine individual risk as a way to help people make informed decisions about their lives and their work?
Yes, absolutely. It has to be evidence-led. Everything that we are doing within the Equality Hub is evidence-led. We have a real focus on data to make sure that we are basing our decisions on what is actually happening and not for reasons of politics or, of, I don't know, other things that are not science-based. So I do completely agree with him. I don't think there's anything to disagree with in what he said.
Shalmura.
Mr. Deputy Speaker, and when in Tuesday's Black History Month debate I said I was angry that 6 months into this pandemic, all we seem to know is that black and ethnic minority people are 2 to 3 times more likely to die from COVID, but not why. The Minister intervened on me and said that today she would give me the answers. But I'm sorry, Mr. Deputy Speaker, she has not. She seems to be saying there's no link with ethnicity, but it's up to individuals to protect themselves. And the report is quite clear. It mentions factors such as socioeconomic background, but it does not say whether those factors are causes or correlations. And so I ask her again, when will we have the data-based evidence as to the causes of this heightened risk? And specifically, are they using artificial intelligence techniques to correlate the different factors so that we know why this is happening in our black communities?
I disagree with the Honourable Lady. I think we have answered the question. Saying that something is a factor means it's having an effect. It's part of the reason. So she's saying it does mean that. We've said, asking for the cause of COVID, what's causing the disease is people catching it. It's a contagious disease. I mean, this is not rocket science. What we are explaining is why certain groups are disproportionately impacted. We've explained that it's household size, it's population density, it's geographic, it's socioeconomic factors. All of those things are having an effect. And we've also explained, I know where she's getting to, but we've also explained that for some groups, when you take out comorbidities, the disparity is completely gone, like with Bangladeshi women and white women. I'm sorry that the report is not giving her the answer that she's looking for, but that's where as my honourable friend rightly said, we're basing it on the science, not based on politics.
I'd like to thank the Minister for her statement, answering 39 questions over an hour, and I'd also like to thank the technicians, as many of the questions were virtual. Thank you very much. Point of order, Nick Smith.
Thank you, Mr. Deputy Speaker. I've received very poor responses from government ministers in recent weeks. I asked about the withdrawal of Randoc's COVID-19 tests. The responses didn't answer the question. I asked about stocks of flu vaccine. I've heard nothing. I asked about customs agents at our ports. The answer was derisory. Just 6 words. We're trying to do our job and hold the executive to account, but this Parliament is being short-changed.
Hear, hear.
Anybody would think the government is trying to block scrutiny and hide its poor performance.
Hear, hear.
Can you please, Mr. Deputy Speaker, advise me if it's the Leader of the House who is best placed to help me seek straightforward answers from his Cabinet colleagues to reasonable questions from members of this House?
I'd like to thank the honourable member for the advance notice of the question that he's given. The Speaker has repeatedly called for departments to give a higher priority to prompt and substantive answers to parliamentary questions at this time when accountability is of great importance. The honourable member is right about the role of the Leader of the House. He could make his own representations to the Leader, but I do hope that the Treasury bench will have heard the point of order, will get that message across to the Leader of the House and to all government ministers and departments. Thank you very much. We're now going to come on to the presentation of the bills, and after that we will then suspend for 3 minutes. Presentation of Bill, Raymond Shishti.
Marriage Authorised Belief Organisations Bill.
Second reading what day?
15th of January 2021, Mr Deputy Speaker.
15th of January 2021. Thank you. We're now going to suspend for 3 minutes in order for the dispatch boxes to be sanitised and for the safe departure and arrival of various key players. Oh, yeah.